Hi guys, this is Dr. Putnam with Richmond Veterinary Clinic. And this is Amanda. She's one of our veterinary surgical assistants. Today we're going to give you discharge instructions after your pet has had surgery. So Amanda, what questions do you get from clients whose pets have had surgery?
A common question I get from clients is feeding instructions. So, how much food they get, how often they get, things like that.
That's a great question. I usually ask them to wait until about 3 or 4 in the afternoon to feed their pet. If their pet has not had any episodes of vomiting or diarrhea, then 2 hours later they can have the second half of that meal. I also ask that they restrict their water intake because if they do drink a lot of water all at a single setting, they have an increased risk of becoming nauseous.
Another question I get often is how much they should restrict their pet's activity.
Also a good question. And that depends on the surgery that they have. For example, cat neuters, I restrict that activity only for 2 or 3 days. For a dog neuter, a cat spay, and a dog spay, I like to restrict their activity for 10 to 14 days. Activity restriction means that we have no access to stairs, no rough play, no running or jumping. And when we take them outside for their bathroom breaks, I ask that they please be on a leash.
Your pet was given an injection for pain during surgery. How would you recommend monitoring their pain at home?
We are sending home oral pain medicine to complement that injection. Please be sure that you read and follow the instructions on your prescription bottles that are sent home with you. And if you have any questions, do not hesitate to call. The other thing I'm going to ask you to do is monitor the incision that we made during surgery. If your pet is able to lick at the incision, or you notice any redness, swelling, or discharge, we may have to fit your pet with a collar that prevents them from being able to reach the incision.
Please monitor your pet's pain at home. If you notice them whimpering, crying out, or any changes in their behavior, that might indicate that they are in pain.
If you notice any of these symptoms, or if there's any anorexia, vomiting, or diarrhea, please do not hesitate to call us. Our phone number is 859 623 3898.